Nursing 431, Evidence-Based Nursing Practice. The course learning outcomes include develop a proposal for a project that will resolve a problem in a professional work area, integrate knowledge from other disciplines when utilizing the research process, apply critical thinking when relating nursing research to practice. The weekly learning outcomes include identify the process of critiquing problem statements and research questions, identify the process of critiquing the literature review section of research articles, identify the process of critiquing the framework section of research articles, describe classification hypothesis, identify sources of nursing research problems, conduct a literature search on a specific topic, obtain references from scholarly resources, extract pertinent information from literature sources, and write a research question for proposed nursing study. Cochrane, a British medical researcher and epidemiologist, originated the term evidence-based practice in 1972. In 1972, he published a book titled Effectiveness and Efficiency, Random Reflections on Health Services that pointed out a lack of solid evidence about the effects of healthcare. He stressed the importance of using evidence from randomized controlled trials, RCTs, also called randomized clinical trials. It took another 20 years for Cochrane's ideas to take hold in the medical profession. In 1992, an editorial titled Evidence-Based Medicine, What It Is and What It Isn't, was published in the British Medical Journal by Sackett, Rosenberg, Gray, Haynes, and Richardson. They defined evidence-based medicine as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. That can be found on page 71 of that article. After this, the idea of evidence-based medicine began to be accepted by many physicians. The Cochrane Collaboration is an international nonprofit organization supporting evidence-based practice by preparing systematic reviews of healthcare interventions, known as the Cochrane Reviews. A systematic review is a rigorous scientific approach that combines results from a group of research studies and looks at the studies as a whole to summarize them, while focusing on a single area of interest. There are 52 Cochrane review groups, each focusing on a specific topic area. The Cochrane Library is the medium used to publish the work of the Cochrane Collaboration. It consists of 6 databases that contain evidence to promote decision-making in healthcare. A 7th database provides information about the groups in the Cochrane Collaboration. The Cochrane database of systematic reviews includes Cochrane reviews based on the best available information about healthcare interventions. These reviews provide evidence for and against the effectiveness and appropriateness of treatments, which include medication, surgery, and educational programs. Cochrane centers are located throughout the world and all share the responsibility for helping coordinate and support the Cochrane Collaboration. Each center is unique and reflects the interest of the individuals associated with the particular center. The Cochrane Nursing Care Field, CNCF, which is on the slide, has a mission to improve health through increasing the use of Cochrane Library by nurses and others, engaging nurses and others involved in delivering, leading, or researching nursing care with the Cochrane Collaboration, supporting the Cochrane Collaboration and its role in providing an evidence base for nursing care. Membership is open to consumers of nursing care, nurses, formal and informal caregivers, other healthcare professionals, researchers, and others involved in the delivery of nursing care. The Agency for Healthcare Research and Quality, AHRQ, is the health services research branch of the U.S. Department of Health and Human Services. The AHRQ serves as a major source of funding and technical assistance for health services research and training. The agency works with public and private organizations to build a knowledge base for healthcare. Evidence-based practice centers, EPCs, develop evidence reports and technology assessments on topics related to clinical, social sciences, science, behavioral science, economic, and other healthcare organization and delivery issues. Topics of consideration are nominated by such groups as professional society, insurers, employers, and patient groups. Their goal is to improve the quality, effectiveness, and appropriateness of healthcare delivery in the United States. The U.S. Preventative Services Task Force, USPSTF, is the leading independent panel of private sector experts in the area of primary care and preventative services. The U.S. Preventative Services Task Force conducts systematic reviews on clinical preventive service, and the results of their reviews are used in making sets of recommendations for use in primary care settings. The task force then reviews the evidence and determines the benefits and harms for each preventative service by a grading system. The National Guideline Clearinghouse, NGC, is a database of evidence-based clinical practice guidelines and related guidelines. It publishes practice guidelines. Research utilization is a more narrow term than evidence-based nursing practice. Research utilization involves the use of results from scientific research studies that concentrate on one clinical problem. Knowledge is accumulated over time and works its way into practice. Evidence-based nursing practice is broader in scope, whereas nursing research utilization begins with existing research that needs to be implemented in practice. Evidence-based nursing practice begins with a clinical problem for which there is no immediate apparent solution. Nurses then seek to find information about the best solution for this specific problem. Stettler suggested a hierarchy of levels of evidence for use in practice that is similar to that proposed by Cochrane. The first level is meta-analysis studies that provide evidence from multiple studies. Next follows single experimental studies. The third level of evidence is quasi-experimental studies, such as cohort studies and time series studies. Non-experimental studies, such as comparative and correlation studies, constitute the fourth level of evidence. Program evaluation, research, and quality improvement projects provide the fifth level of evidence. Finally, the opinions of authorities or experts is the sixth level of evidence. Non-research sources of evidence include pathophysiology, cost-effectiveness analysis, benchmarking data, clinical expertise, infection control data, international, national, and local standards, quality improvement and risk data, retrospective or concurrent chart review, and patient preferences. Evidence-based practice centers in nursing include Academic Center for Evidence-Based Nursing, Joanna Briggs Institute, and the Sarah Cole Hirsch Institute for Best Nursing Practices Based on Evidence. This is a new concept in the area of evidence-based practice known as care bundles. It is believed that care bundles, which group together several evidence-based practices, or when interventions are used in combination, will have a greater effect on outcomes than if just one intervention was used. The acronym PICOT, is a commonly used format for writing clinical questions for a specific clinical problem. This format was developed by Feinholt and Overall and Johnston. And the 5 letters stand for: the P is for patient or population, I is the intervention or interest area, C is the comparison intervention or current practice, O is the outcomes desired, and T is time to achieve the outcome, which the T is optional and is not always included in your PICO format.